is Kim Birch, and I am the Immersive Learning Coordinator for the Graduate Nursing Program. If you're watching this video, then you are a student enrolled in one of Purdue Global's Nurse Practitioner Program tracks. Within your NP program, you will be engaging with virtual reality to complete patient scenarios within a program called PCS Spark. I'm here to present to you the first in a series of videos about virtual reality and what you as a student can expect from this technology during your program. This very first video is a pre-brief training and an introduction to some of the basics of virtual reality. Please know that in my role as an immersive learning coordinator, my job is to help support you as you use VR within your courses. And if at any time you have questions about the technology or scenarios, please reach out to me and I am happy to help you. Just a little bit of background about me. By training, I am a family nurse practitioner. Most of my nursing career as an RN and a nurse practitioner have been in emergency medicine and in urgent care settings. I am still currently practicing about a day a week in an immediate care setting. And I also have worked as an assistant professor at another university teaching in a graduate nursing program with nurse practitioner students. Some of our goals for today are to review some background information about virtual reality. I'm going to talk with you about the goals of using VR within your nurse practitioner program, and then also discuss some potential problems of using VR that you may run into as you use this program. So to start at the very beginning, what is virtual reality? I'm sure in some way or form you all know a little bit about what virtual reality is, but the basic definition is that it is a computer-generated simulation of a three-dimensional environment. All of you should have a MetaQuest headset, and by wearing these headsets, you are allowed to manipulate objects within the 3D environment and to feel fully immersed within a simulation or scenario. So you may be wondering, why are we using virtual reality and using these headsets in your nurse practitioner program? Well, I want to give you a little bit of background about VR in healthcare to help answer this question. So VR has grown significantly within the past 5 to 10 years in its use in academic research, clinical practice, and education in the healthcare system. And I wanted to give you a few examples of how VR is being used. The first one has to do with patient care, and I want to share with you a study that was done at Harvard University. So for this study, they had patients that were receiving carpal tunnel surgery. They had one group of patients that only received anesthesia, so they received propofol during surgery. And they had another group that did receive propofol, but they also had them wear VR headsets and had, a calming environment playing while they were receiving their surgery. And they did find that the patients that had the VR headsets, they actually needed less propofol, less anesthesia, because the VR headsets were able to help calm them and help with pain relief during their surgery. So that's just an interesting example of how we can use VR to help our patients within a clinical setting. Another example I want to share is from Stanford University. Now, I mentioned my background is emergency medicine, so that's why I chose this example. But I'm sure some of you have some experience working in an ER, but you can learn how to take care of patients. You can learn the tasks and the things that you need to do within an ER, but it's very hard to practice feeling the overstimulation that you can have sometime within that environment. When I worked as a nurse practitioner within the ER, I may have 4 or 5 patients that I need to go see. I have a nurse handing me an EKG. I have another nurse telling me that they need Zofran in room 3 right now. And then there's EMS walking through the door. There's lots of different things going on at the same time. And it's hard to really practice how to multitask and how to manage that. So Stanford did a study with some of their emergency medicine physician residents, and they put all of these residents within a simulation and they practiced just that. They had multiple people coming up to them and interrupting them and asking for things. And after this scenario, they debriefed with the physicians and, they talked about, how could we manage this better? What are some coping mechanisms you could do? So it just provided an opportunity to really practice that big component of working in an emergency department that is very hard to simulate and practice when you're learning in school. I do want to share one other example with you from Stanford as well. Stanford University has a virtual reality and immersive technology clinic. Within this clinic, they're able to use VR to provide sensory feedback, retraining, and education. They're able to integrate VR and augmented reality with traditional cognitive, behavioral, and mindfulness-based therapies to create a more holistic approach to treating some of these different psychiatric conditions. So this is a really interesting way that VR is being used within an entire clinic at Stanford University. The last example I wanted to share with you is actually at a local hospital where I worked at. So HCA, that's just a network hospital system. I worked at a level 1 trauma center in the Midwest, and the local hospital, just down the road from me, they're using VR simulations for continuing education of their staff, and especially with their nursing staff. So one example is they have some scenarios for if there's a fire in the OR. They have a scenario that has to do with an obstetric emergency, and they bring all of their nursing staff together and they work through these simulations. So it's just another way that they can provide continuing education for situations that, don't happen every day. This next slide shows you the mission statement for Purdue Global's nursing program. And that is to provide personalized nursing education to launch and enhance nursing careers that meet changing healthcare needs in local and national settings. And the thing I want to highlight on this is that we want to provide education that meets changing healthcare needs. The previous slide, I showed you all these different emerging examples of how VR is being used in actual healthcare settings. And we as a program really believe that using virtual reality meets our mission statement of how we can help prepare you for these changing needs. And it really is a unique opportunity for you as a student to get to use VR. And this is just another way that we can help prepare you to become a great practitioner when you leave our program. I'm going to shift gears a little bit, and I'm going to talk about a few things that have to do specifically with the VR simulations that you are going to be using within your program. The first thing I want to share with you are some of the goals when you do these virtual reality scenarios. So every single scenario that you do within PCS Spark has these 3 learning objectives. And our goals of using this program are to expose you to a wide variety of clinical conditions and patients across the lifespan. We want to give you an opportunity to show your independent learning and management skills. And we want to give you an opportunity to practice and demonstrate your readiness for your licensing exam that you will take at the end of your program. One thing I want to point out when you're completing these VR scenarios is that even though we try our best to create a realistic environment for you to be immersed in, not every aspect of this simulated experience is going to be completely realistic. The biggest piece that is different is going to be the health assessment piece. You're not able to fully palpate an abdomen when you're within a VR scenario. There are a few little quirks in the system that make it not totally realistic. And I found that that is one piece that students can get hung up on sometimes, that the health assessment piece is not fully realistic. But I do want to point out to you that the goal of using this is not to have a totally realistic health assessment piece. The goal is to put every piece of a patient encounter and visit together and to give you an opportunity to practice every component of a visit. Simulations are a safe place that you can come in and you can practice your skills, and you can practice multiple times. We all know that you're nurses and that you have been doing health assessments with your patients. We want you to be able to put everything together as you practice your skills in becoming a nurse practitioner. So our goals are, we want you to practice your communication, complete a full HPI on a patient, ask all those review of systems questions and to kind of get into a groove and figure out how you can do that with every patient. Yes, we want you to perform the physical assessment, but then we also want you to use what you gather from that in order to figure out what you need to order lab-wise, diagnostic-wise. We want you to practice developing your differential diagnoses and then develop a follow-up plan of care. So what are some basic things you can expect about using VR within your program? So all of your future classes will have 2 to 3 VR cases per each didactic course that you take. The psych mental health track has 2 cases per class, and primary care and acute care have 3 cases per class. Time expectations, it is a new technology, and so of course there's going to be a learning curve to it. So I would say when you first get into the program and you're starting to learn it and you're starting to play around and figure everything out, anticipate about 1 hour to complete the scenario. Now, it may not take you that long. Some people are able to go in and complete it within 15 to 20 minutes, and that is perfectly fine. But I want to give you this hour time frame just to give you some time to figure things out. So when you go in and you do your first case in your first class, don't anticipate that you can just go in and, get it done really, really fast the night before that is due. It will take a little bit of time to get used to the program. That being said, though, you can take breaks during a scenario. You don't have to put your headset on and spend a full hour trying to figure everything out. You can take your headset off, you can take a break for a little while, and you can come back to it. I do want to take a moment to talk to you about a sensation called VR sickness or cyber sickness. This is a phenomenon that is closely related to motion sickness. And essentially what is happening is that your brain believes that your body is in motion when you're within the VR headset, even though you are actually standing still. And this can cause a disconnect between your body and your mind, and it can cause some symptoms like nausea, headache, or dizziness. Now, not everyone who puts on a VR headset is going to experience VR sickness, but I do want to point out that it is something that can happen to you. Now, research has shown that there are several factors contributing to developing VR sickness. For instance, if you are within your VR headset and you are playing a video game where you are running and jumping and doing lots of activity, that is going to be more likely to contribute to you having these symptoms. Within PCS Spark, you are going to be relatively stationary, talking with a patient, not moving around a lot. So that decreases the likelihood that you will experience severe cyber sickness, but it is something that you may experience. So I do want to point it out as a possibility. Now, what are some things you could do to help prevent this from happening, or if you find yourself happening some symptoms, how could you improve it? One way is that you can allow your real body to move. So you have your VR headset on. Within the VR headset, remain stationary, but allow your real body to move. Lift your hands in the air. Just become aware of your actual physical body. And this can help kind of reconnect your body and mind and help improve some of those symptoms. Kind of along those same lines, you can use some other sensory inputs. So if you have a fan blowing on you, if you're chewing gum or have a mint or have some, essential oils and pleasant smells going in the room, that can help kind of keep your brain grounded to where you are in space and time. And that could help potentially improve some of your symptoms. Another thing that you can do is reduce your exposure time. So they found that the longer that you have a VR headset on, the more likely you are to experience some cyber sickness. So I would recommend the first time you put on your headset, maybe only spend 10 minutes or so, and gradually increase the amount of time you spend in the headset to build your tolerance. Now, all that being said, if you've tried some of these techniques, if you've done all of this and you still find that you are having a lot of cyber sickness, please reach out to me. Please reach out to your instructor. And we do have alternate assignments that you could do if you find that you have VR sickness that is uncontrolled. So please do not feel like you have to power through these scenarios if you're having difficulty. Reach out to me, reach out to your instructor, and we can talk to you about what the next steps are. And one of the last things I want to point out to you is that you should always use your Purdue Global email to log in. When you are in your class, your instructor will provide you with some links to access your scenarios within PCS Spark. And I do have other videos that will explain this process more. But always make sure that you're using your Purdue Global email when you log in and you're doing your PCS Spark assignments. Now, this is just very basic, some of the introduction to VR. When you get into the program, if you find that you need help or you're having questions, there is a help desk within PCS Spark, which I will point out to you in other videos. And then, of course, you can always reach out to me, and I have my email here for you. If you have questions about the content that is being covered with the scenario, that would be a good question to reach out to your faculty about. And then this last screen just has my references for some of the things I shared with you today. Again, please reach out to me if you have any questions or any concerns about virtual reality.